So this video will go over the anatomy of the female reproductive system. The primary organ of the female reproductive system is our uterus. Coming off either side of the uterus, you'll find a uterine tube, also known as a fallopian tube. At the end of the fallopian tube, but not attached, is the ovary. The uterus exits the body through the cervix, down through the vagina, and then out through the external opening. Surrounding the body cavity and the uterus is the peritoneum. The peritoneum continues around the uterus with the rectouterine pouch. Uterus is held to the abdominal cavity via the round ligament. The ovary is held to the abdominal cavity via the suspensory ligament. Here is the model in lab where you can see these features. So your round ligament, the fimbriae, and we'll look at these closer in the next diagram. The uterine tube, the ovary, and this is our ovarian ligament. This is the fundus of the uterus. We can see the layers of the uterus. The innermost layer is our endometrium. Myometrium is the middle layer, and the perimetrium is the outer layer. Right here we can see the cervix going into the vagina. The uterus sits on top of the bladder, and here is the urethra with the external urethral opening. Here is the clitoris, the minor labia, and the major labia. Rectum is back here. So this would be the model that you would possibly label in lab. Here's another depiction of how the uterus sits in the pelvic cavity. And so here's the uterus. You have the paired uterine tubes coming off either side, the fimbriae surrounding the ovaries held to the uterus, with the ovarian ligament suspended to the pelvis with the suspensory ligament, and then we have this sheet-like ligament, the broad ligament, that holds multiple parts of the female reproductive tract into place. Uterus sits on top of the urinary bladder, and here's the vagina coming out through the pelvis. So here is a more detailed picture of the female reproductive system. Uterus, you can see the uterus is divided into three sections: the fundus, the body, and the cervix. And then the vagina continues the female reproductive system out into the world. The vagina has ridged regions. These are the rugae. This little pocket here is our fornix. Coming off superior laterally off either side of the uterus are the uterine tubes. They continue around. Where the uterine tube connects to the uterus is the isthmus. These finger-like projections are the fimbriae. Right here, this is where fertilization takes place. This is the ampulla. And then the very end of the uterine tube is the infundibulum. So the fimbriae surround the ovary, but they never actually touch the ovary. And so there's a very minute gap between the fimbriae and the infundibulum of the uterine tube and the ovary. So technically, it's an open channel from the entrance of the vagina into the abdominal cavity because the ovary and the uterine tubes are not physically connected. There is a slight gap between them. Other thing you can see on this, again, our broad ligament, which is a sheet-like ligament holding everything in place. You have the ovarian ligament holding the ovary to the uterus, suspensory ligament connecting the ovary to the pelvis. Here is the round ligament holding the uterus to the pelvis. The three layers of the uterus, the inner layer is the endometrium, middle layer is myometrium, the outer layer is the perimetrium. That is the wall of the uterus. You also have the uterosacral ligament and the lateral cervical ligaments. So the ovaries are where the ova are produced, also where hormones estradiol, estrone, and estriol, as well as progesterone and inhibin relaxin are made. Those ligaments, the ligaments that provide structural ovaries in place, and then the suspensory ligament, which holds it to the abdominal wall. With ovulation, an immature gamete is released from the ovaries, expelled into the uterine tube. The fimbriae sweep the ovary and catch it. And as I mentioned before, fertilization occurs out here in the ampule in most cases. We mentioned those three regions of the uterus earlier. The fundus is the rounded superior area of the uterus. The body is the main region, and then the cervix is where the uterus narrows into and changes into, well, not changes into, but releases into the vagina. Those three layers are endometrium. The endometrium, the majority of it is what is sloughed off during our menstrual cycles. The myometrium is smooth muscle involved in contractions. And then the perimetrium is that outer layer that helps to give it support, made up of connective tissues. Other ligaments that we mentioned previously that are responsible for supporting the uterus, the lateral cervical ligaments down here are uterosacral ligaments. The round ligament, which connects the uterine body to the pelvis. And then broad ligaments, they help support the uterus laterally. So the broad ligament plays a lot of roles in supporting the entire female reproductive tract. Vagina is our receptive organ. This is where copulation takes place. So it is also used for giving birth. So as I showed you before, the vaginal wall has those rugae, which allow for the penis to enter by expanding and accommodating the penis during intercourse. We also have glands and secretions in the vagina, which help to mobilize We also have epithelial cells that secrete glycogen in the vaginal lumen. This helps to maintain the acidic pH of this region and help to cut down on bacterial growth, preventing infections. When we're young, we have a mucus layer near the distal vaginal orifice that commonly ruptured during our first sexual intercourse, but if you use tampons when you start menstruating, a lot of times the hymen is broken before that. Here is the model that we'll be labeling in lab, and you can see how it closely resembles this diagram out of your text. External female genitalia. The fattened mound up here is the mons pubis. You have the pubic bones internally on either side. The clitoris is at the anterior. The labia majora are the outer lips. The labia minora are the inner lips of the vagina. The labia majora will have hair on it. The labia minora will not. This is the urethral opening from the bladder. You have paraurethral glands, have a vaginal orifice here, and a comparison for the vagina has been given like a paper bag. If you have a paper bag that's folded when the vagina is not engaged in intercourse, it is folded like a paper bag, and then when the penis enters, it's like opening the paper bag. Here are the openings for our greater vestibular glands, and these are similar to the bulbourethral glands that we saw in the male reproductive system. All of these together are the vestibule. The perineum is this triangular shaped area, including from the clitoris back to the anus. That perineum, that diamond-shaped region that we just looked at, sometimes has to be cut, or if it is not cut, can be torn during childbirth. And so surgeons a lot of times will go ahead and cut the perineum so that it heals better, because a clean cut is better than a jagged tear during childbirth. And that's to allow the vagina to expand, to allow the baby to exit. Mammary glands are also part of the female reproductive tract. They are modified sweat glands. Their main role is to make milk. Each mammary gland is found in the hypodermis, so in a layer of fat enclosed in a skin-covered breast. The breast lies on top of or is superficial to the pectoralis majors muscle, and the darkened circle on the breast is the areolar. In the center is our nipple, and the nipple is where the milk exits the breast. Within the breast, you have mammary glands. Each one is composed of 15 to 25 lobes. So these are lobes right here. Each lobe supported by fibrous connective tissue, this white lines running between each lobe. You have a suspensory ligament that helps to comes together and holds the breast to the muscle fascia underneath. You have lobules within the lobes. These are the smaller glandular alveoli within the lobules, produce the milk during lactation. So this lower half is a lactating breast where the alveoli are swollen and producing milk. This upper area is a non-lactating breast where the alveoli are not producing milk. And you have myoepithelial cells within and around. So the milk is made in the alveoli, and here you can see a secreting alveoli and a non-lactating alveoli. So once the milk is made in the alveoli, it then travels to the lactiferous duct, travels to the mammary ducts, which flow into the lactiferous ducts, and then it accumulates in our lactiferous sinuses, where once the infant starts to suckle, it is released through the openings in the nipple. Here is a summary of the female reproductive organs, the internal genitalia and the external genitalia. And here it is in a table form also, the internal and external genitalia of the female and the functions of each. Breast cancer is one of the major diseases of the reproductive system. In the United States, there's over 200,000 cases diagnosed each year. And it's not just for women. Breast cancer occurs in men also. Big risk factors for breast cancer: longer reproductive span, early first menstrual cycle coupled with menstruation continuing into a later age, obesity, no pregnancies or your first pregnancy after the age of 35, presence of breast cancer genes. The two most common are this BRCA1 and BRCA2. And here you can see that 50 to 65% have BRCA1 and 40 to 55% have BRCA2. Not as high in males. Pancreatic cancer, you can see the BRCA1, BRCA2. Prostate cancer, BRCA1, BRCA2. But in ovarian cancer, also a high percentage have the BRCA1, BRCA2 mutations. A big problem with a lot of our breast cancers is that they're painless until they become advanced, and at that point they have metastasized and spread. So a good preventative is to have a mammogram every year, and this is what a mammogram of a breast looks like. This is a clean mammogram, and this is one with a tumor. Sometimes the malignancies are palpable, but not always, and so the mammograms can hopefully pick them up early before they are palpable. You should have regular mammograms before over the age of 50, and if there's a history, then you should have them before the age of 40. Treatment, as long as it is not advanced, can be a lumpectomy. If it is more advanced, then you have to have a mastectomy. Those tend to be followed by at least radiation therapy and chemotherapy sometimes. And that wraps up our talk on female anatomy.